80,000 New Zealanders got a vaccine yesterday, by far the biggest day that we've had since we started rolling out the vaccine in New Zealand. From today, if you're over 30, you can book in to get your vaccine. This is quite a shift towards one of our larger groups who have a very important role to play in keeping us all safe. The 30 to 39 age band includes around 700,000 New Zealanders. I know a good proportion of them had a good laugh at my expense over the last few days, so my message to you is if you had a good laugh, I only ask that you pay me back by going and getting vaccinated. You can go online to bookmyvaccine.nz or call the COVID vaccination healthline on 0800 28 29 26.
So today we are reporting 63 new confirmed cases since 9 o'clock yesterday morning. Of these, 62 were in the community and one is a recent returnee in managed isolation. This brings the total number associated with this outbreak to 210 cases. That is in the Auckland community outbreak. Of these, 198 are in Auckland and 12 are in Wellington. That's an increase of one case, as you will know, on yesterday's number for Wellington. This is again another close contact of one of our existing cases. There are currently 12 people in hospital with COVID-19, an increase of 3 since yesterday. 11 of these are associated with the current outbreak. None of those involved in the outbreak are in ICU. So with our current outbreak, the numbers again have gone up to 63 today, or actually 62 with the outbreak, and that's an increase of 48 from 48 yesterday. The good thing about this is, while this is steady growth, it is not exponential. We do know that our actions to slow and spread the virus will begin to see a slowing of those numbers increasing, and indeed the fact that the rate of increase is not exponential is explicitly because we have Alert Level 4 in place. There are now even more locations of interest, and those currently being added are generally supermarkets more recently, some other locations of interest. My understanding is there were just over 40 locations of interest added today, and if you think about the large number of new cases, that's clearly a much smaller number than we have seen in other days. Wastewater samples around the country from more than 70 locations have been analysed or are currently being analysed, covering an estimated 3.6 million people. Aside from the known wastewater results in Auckland, Warkworth and Wellington, there are no other positive wastewater results, including from the 5 sites in the Coromandel. On the Pacific community, back to that again, you would have seen, many of you, a tweet from the Ministry yesterday identify that there are some racist remarks and comments being directed at the people in our Samoan community affected by the current outbreak, and this is disappointing and frankly gutless. I'm asking everyone in the country to be kind. The virus is the problem, not people. People are the solution. Be part of the solution. There's a tremendous amount of work going on with this community, and as we have seen in past outbreaks, they're incredibly responsive, and I want to thank all the community leaders who are supporting our efforts to reach out into and ensure that we support and look after that community and identify any cases there, which will be to everyone's benefit. And finally, I've just been briefed on the team before I came down on the incident around the possibility of some people receiving saline instead of the Pfizer vaccine at the Highbrook vaccination site. This occurred on the 12th of July, and there were 732 people vaccinated that day. At the end of the day, at that time, there was a reconciliation process of all the vials, and there was found one vial left over that could have been interpreted that some people did not receive the vaccine that day. It's only a possibility. It's not clear that anyone received just a dose of saline rather than vaccine. So there's been a lot of work that's happened since. In the first instance, immediate protocol changes were made to move on all sites to more frequent checking and reconciliation of vials, rather than leaving this to the end of the day. Then, if there is a problem found out where the numbers don't reconcile, it's a much smaller group of people who we can define who may have been affected. Secondly, there are labels now put on syringes once they have been drawn up. That's happening everywhere. in our large sites. Another thing that's being done is only one vial at a time is taken into the place for drawing up. So in this case, where it's not clear that we had some people, a small number, possibly 5, who hadn't received a dose, most of those people would have received a dose. So we've been seeking advice from our technical advisory group on what's the best approach to whether or not people are offered a further dose. Again, I just want to reiterate that it's still not clear that anybody missed out, and if anyone did, it would be 5 of that those 732 people who are also scheduled to, and some may already have had a second dose. Everyone who was involved in that incident will receive a letter within the next 24 hours, and there will be further follow-up discussions with them about what the next steps will be. And again, we're still waiting on the advice of our clinicians and scientists about whether everyone should be offered that third dose or not. But we will keep you updated as that scientific advice comes to hand.
Our specific drive to ensure essential workers are vaccinated is also tracking well. We've seen more than 6,500 essential workers get access to the Pfizer vaccine just over the last week. Feedback's been extremely positive from supermarkets in particular. They want to make sure that their staff are protected at alert level 4, and we're working with them to ensure that that can happen. From tomorrow, all government border workers are required to be vaccinated. There'll be checks and balances in place to ensure that that happens. That's the first of 2 deadlines we have in place. By the end of September, the wider border workforce, who weren't covered by the first required vaccination order for border workers, will also need to be vaccinated. These further measures will again strengthen our border requirements and strengthen our protections against COVID-19. To quickly remind you of the daily numbers, 2,932,455 doses of the vaccine have been delivered so far. Over 1 million of those have been in Auckland, so over a third of the doses of vaccine that have been delivered so far have been in the Auckland region. We do know that learning from home puts a huge amount of strain on students, on parents, on teachers and on educational leaders. So I want to send a big shout out of thanks to everybody that's involved in ensuring our young people's education continues whilst they are at home at alert level 4. We do know that it can be difficult and stressful for teachers in particular, and so we have put in place extra support for teachers through the Employment Assistance Program. That's available from today. It is free of charge. We've made funding available to the Ministry of Education so that they can support schools and kura to meet the costs of providing materials to young people whilst they're learning from home. We're also making sure that learning packs are available centrally where schools are unable to produce them themselves. And we are also particularly focused on getting digital devices out to the young people who need them. So around 7,000 devices should go out in the next few weeks. That's on top of the 36,000 digital devices that we sent out last year. Live education TV has been reactivated, both on TVNZ and Māori TV. That comes on stream from today, and there is also on-demand content online. We'll continue to work to connect households to the internet that aren't connected to the internet where they have learners in them. Finally, a word on Parliament. Select committees are meeting this week to ensure the ongoing scrutiny of government activity. That includes ministers being present at virtual select committee meetings to answer questions on almost every aspect of our COVID-19 response. And to some extent, that is providing a greater question and answer opportunity for members of Parliament than would be the case if Parliament was sitting as normal. We are very mindful of the need for that scrutiny, and we're also very mindful of the need for Parliament to be able to come together sooner rather than later. So the government's view is that we should explore all opportunities for Parliament to be able to meet virtually rather than travelling here to Wellington at the current point in time. And we will work with the Speaker and the Business Committee to explore all of the ways that could be done. Other parliaments around the world have used remote meeting technology to allow them to continue to undertake all of their functions whilst restrictions are in place, and that is something that we'll be actively exploring here in New Zealand. And we'll do that through the Speaker and through the Business Committee, and of course we will aim to reach a consensus on that if we can do. And I ask simply that all other parties participate in that process constructively.